type 2 diabetes, which is also known as NIDD और नॉन इंसुलिन डायबिटीज। NIDD का मतलब ये नहीं, जरूरत नहीं है पेशेंट में नीड oral hypoglycemia will stop working, or if there is any condition like infection or pregnancy or any other stress, but ऐसा नहीं है कि also, but there is more pathogen, more risk of insulin type 2 diabetes. Long standing diabetes, various complications can lead to why is important diabetes। हाइपरग्लाइसीमिया रहेगा तो क्या होगा, there will be pathogen changes, like there may be complications like microvascular complications happen, like nephropathy में neuropathy में the microvascular, and there may be macrovascular complications, like there may be cardiovascular accidents like stroke may happen, vascular accident, or there may be myocardial infarction are included macrovascular. There are two complications, microvascular are retinopathy, neuropathy, nephropathy. Macrovascular stroke, myocardial infarction. So why hyperglycemia occurs? It occurs because of the underutilization or because of the overproduction of. When there is a deficiency of insulin, there is a reduction in the transport of glucose to the cell. So basically the cellular uptake, because insulin help in the cellular uptake of glucose by the various transporters that are known as blood transport. Whenever there is deficiency of insulin, there will be deficient uptake, cellular uptake of glucose rise in the blood sugar. When the cells are unable to take up the glucose, obviously the blood glucose will rise. Okay. So insulin acts just like a suction pump. As you know, the suction pull the water, really help in the uptake of the glucose. Whenever there is deficiency of the insulin, there will be rise in the blood glucose. So what will happen? There is reduction in the transport of the cells, reduced glycogen formation, and more breakdown of glycogen and formation of glucose from other sources like glucose. There will be increased formation of glucose from non-carbohydrates. Then all these blood glucose level, but the cell is not able to use because of the deficiency of the. So it is similar like the man is standing and it's thirsty for the water. Like similar situation occurs if the man is standing in the ocean, but he cannot drink water because the water is very salty. So the similar situation, because there is a lot of sugar, lot of sugar in the blood, but the cells cannot utilize. Okay. So insulin acts just like a suction pump for the glucose. So what are the American diabetes criteria for the diagnosis of diabetes? So if out of these four, if any of these happen, that patient is diagnosed as a case of diabetes. Like the symptoms of diabetes occurs like polyuria, polyphagia, along with the random blood more than 200. Suppose you patient come in the OPD and random blood comes to, and he is also suffering from various symptoms like having polydipsia, polyphagia, polyuria. Then their patient can be diagnosed as a case of diabetes. Then if the fasting blood glucose is more than 156 milligram per cent, the 2-hour plasma glucose more than 200% oral glucose tolerance. What is oral glucose tolerance? होता है ग्राम at the interval of half an hour के interval पर हम उसको and after 2 hours we monitor the blood glucose. It is more than 200 milligram percent that there is positive blood glucose. But this is not usually for the diagnosis of diabetes, but especially in case of if the HbA1c more than 6.5%. So, but in the diabetic patient, the target is the HbA1c for the 7%. But in the normal person, target should be less than 5. Why? Diabetic target because अगर हम diabetic patient और target of hypoglycemia, that is why the target other normal person. What is H होता है? It is glycose and it does the control of blood sugar during the last 3 months. Tells us about the of control of blood sugar last 3 months. Then diabetes classified as type 1 diabetes or insulin diabetes. There is absolute autoimmune. The antibodies are formed in the cells of hormone is the cells of alpha cell से क्या आता है glucagon and delta cell से the type 1 what will happen there is formation of autoantibodies against the beta cells of that will damage the beta cells of certain absolute deficiency. Important plays the insulin deficiency the form of insulin hormone. Type 1 diabetes primarily by the in type 2 diabetes mellitus or non-insulin diabetes mellitus, there is also deficiency of the insulin hormone, but it is not absolute deficiency. Some beta cells are still working, and there may be hormone, but there may be because of the insulin beta cells are working, they are not. In type C disorder, also known as diabetes of young or MODY. In type 4, because of the secondary of pancreas like because of the type 4 diabetes. And type 5 is also known as gestation. These are the various types of the. Then we can classify anti-diabetic according to their route of action. For example, parenteral route and oral route. Parenteral hormone, then GLP-1 agonist, for example, exenatide, then pramlintide, amylin, polypeptide, amylin, then asaramine. These are the parenteral are given by the injections, injectable route, IV or primarily subcutaneous. Some insulin can also be given by intravenous, for example. Then oral, all other type 2 diabetes, all other oral hypoglycemic drugs, oral hypomorphine are the oral. Then coming to the reduction in blood sugar, there are some drugs that can cause hypoglycemia because of the release of the insulin cells of the pancreas. They will produce hypoglycemia. Drugs are known as hypoglycemic. Example is sulfonylurea. And second is euglycemic. Drugs they control blood sugar, but they will not cause hypoglycemia, or there is very little risk of hypoglycemia. Drugs are known as glycemic. For example, metformin. Metformin is diabetic, not a hypoglycemic. Reduce blood sugar, control the blood sugar, but there is very less risk of hypoglycemia, negligible risk of hypoglycemia. Metformin is diabetic, not a hypoglycemia. Similarly, glucagon, these drugs have very almost slight risk of hypoglycemia or also glycemic. Then according to mechanism of action, like replacement of the like there is deficiency can replace. Okay. Then drugs promoting the which are also known as the sedative gogs like sulfonylureas, glitinides, agonists. Then sensitizers that insulin drugs are known as insulin sensitizers like thiazolidine, metformin, glucagon are the insulin. Don't write everything is given. They are known as the insulin sensitizers. Then inhibitors of the glucose absorption. There are some drugs there with the absorption from the GI, like akerbose, oglibose. Then drugs acting by messenger like those protein drugs act by the miscellaneous. Then what is anabolic hormone? So it is anabolic hormones. Without the insulin, the cells are deprived of the glucose, the main source of energy for most of metabolic function. Then it is involved in the utilization and storage of energy, whereas counter-regulatory hormones maintain the availability by enhancing release and reducing the utilization. And insulin decrease the blood sugar, while the counter-regulatory hormones like growth hormone, corticosteroids increase the blood sugar. Then coming to the various types of insulin. So traditionally, the insulin is divided into short acting. Example is regular insulin and semi-lente. Okay. Because they have quick onset of action and their action lasts from 4 to 6 hours. Okay. Then coming to the intermediate acting, the onset of action starts in 4 to 6 hours, but the duration of action is very long. Okay. But from 8 to 12 hours. Example is neutral protamine H-dog and lenti insulin. What is lenti? Lenti is insulin zinc suspension, known as lenti insulin. Why zinc is the insulin? Zinc you have prolong the duration of action of insulin. Zinc is added to prolong the duration of action of insulin. Insulin is available in two forms. One is monomeric form, which is active form. Okay. And one is hexameric form, which is primarily used as a storage form because it is neither available for the metabolism nor for the action. So the zinc stabilizes the hexameric form of the enzyme. And if it is a hexameric form, it will release slowly and slowly in the circulation. So this will not be action, but it will release and slowly in the circulation in the monomeric form. So what will happen that it will prolong the duration of action of insulin. So anti-insulin at zinc will stabilize the hexameric form of the insulin. So zinc is basically added to prolong the duration of. So again the lentil zinc insulin preparation again may be of three types. One is very short acting, example is semi-lentil. One is intermediate acting, example is lentil. Another is very ultra long acting. If the duration onset of action approximately or duration of action very long. Okay, so that is known as ultra lentil. So this is the classification of the traditional insulin. Then coming to the insulin analogs, why they are called as insulin analogs? Analogs to both. That's very good. So these are work similarly just like insulin, just like traditional working similarly. Okay. But their chemical structure may be different from the traditional. Work exactly like human insulin. Okay. But their chemical structure may there may be slight changes like may replace we may replace one or two amino acids. Okay, for example, this pro में हम lysine amino acid add that is known as this pro. इस part में हम aspartic acid aspartate amino acid को ऐड कर देते हैं. टू lysine में glutamic acid और lysine के because there is change in the chemical composition of the glutamic acid or lysine, that is known as 2-lysine. So they work similarly to human insulin, but their chemical structure may be slightly different from the traditional. Example of ultra short acting or rapid acting and part. So these are the examples of the ultra short or rapid acting. Then ultra long duration and short. Example is Clargine, Declutate, and Detergene. Once they are given, they will work for 24 hours. Okay. So then patient will require only once a day injection. As you can understand from the name, the Glargine, there is name is written large. You can understand it is very long. Glargine. Second is Digludate, and out of these three, the Digludate is the longest acting. Insulin are also known as peakless insulin because they will release the circulation. Their duration of action is 24 hours. So there is no peak. These are also peakless insulin. Then most of the insulins are supplied at neutral pH, but glargine is supplied at the acidic at 4 pH 4. We cannot mix glargine with other insulin, but we can mix other insulin. They are also known as pre-mixed insulin. So we should not add glargine to any other insulin. Glargine is separate. So why advantages over traditional insulin. Also, these analogs are very costly, but still they are used by. What are the advantages of analogs over other? Why they are used? How is very good. Because this is hypoglycemia. Most important, most common side effect. Chances of hypoglycemia polypeptide hormone. If you will give the orally, it will get the GIT. Orally. Metformin is oral hypoglycemia. Insulin we cannot give insulin. Because this is GIT. Polypeptide hormone. And we cannot give peptide orally. Peptides are always given by injectable route. What advantages of traditional insulin are obtained from the cord of bovine insulin. So they are obtained from animals. The risk of allergy they are used. So the chances of allergy is very less. They are produced if there is human insulin or if they are produced by the recombinant DNA. The risk of allergy is very less in these analogs. But there is less of insulin resistance. Chances of insulin resistance is less. Other that they have very short onset of action. Like this pro insulin can be taken just to control the postprandial hyperglycemia. A very quick onset of action. It starts within 10 to 20 minutes. Okay, so they can be just before meals. And there is also less risk of insulin dystrophy or lipoatrophy, which can happen with traditional use. So these are the advantages of the analogs for the traditional insulin. Then, so this is all about the analogs. Anyone tell what the chemical structure of insulin? Yes, very good. It has got 51 amino acids. Two chains, A chain and B chain. A chain में कितना amino acid? 21, 20, 31. These two are linked together by the C peptide. It is secreted from the beta cell from polypeptide never be given orally. And this is the major limitation of insulin. It cannot be orally. And as you know, diabetes is lifelong disease. Patient is suffering from diabetes, type 1 diabetes, he will need to take injections. Like it is a very painful thing. It cannot be given orally. Now, what are the important adverse effects of insulin? The most common and most important adverse effect is hypoglycemia. How can you prevent prevent the risk of hypoglycemia? Suppose if you are prescribing in any patient, how will you educate that patient to decrease the risk? That's very good. The drugs as well as the diet. Do not skip the meals. And if suppose hypoglycemia happens, what you will ask the patient always readily available source of glucose. Okay. Like you can take some candy or glucose powder or biscuits or some sugary source. Okay. And dissolve the glucose powder in the water and take orally. But if the hypoglycemia is not corrected by given orally, but intravenous glucose, not treatment of hypoglycemia is the most common and most important. What are the various symptoms of hypoglycemia? Suppose if the patient is hypoglycemic, how will you diagnose? What are the various symptoms? Tachycardia. Tachycardia. Basically, there are two types of symptoms. First, there is the symptom because of the sympathetic overstimulation. Because of the sympathetic, what that patient will having sweating, tremors, tachycardia, palpitation. These symptoms are because of the sympathetic overstimulation. This is followed by neurogenic symptoms. That's because of the decreased blood glucose supply to the brain. For example, patient will having confusion, having headache, alteration of vision, confusion, irritation, and hypoglycemia is not treated patient with coma, hypoglycemia and a dangerous situation, dying because of the hypoglycemia. So it is very important to advise the patient to always take right time, never skip meals. Whenever any patient is advising never skip meals or meals on right time, take on all drugs on right time, then don't do any heavy exercise. Okay? And when and he has to educate for the various symptoms of hypoglycemia. That these symptoms are the symptoms of hypoglycemia or something that immediately. So these are the that you will provide to Now, second important ADR is allergic reaction. Allergic reactions happen because traditional influences are obtained from the animal source. There is a risk of allergy or hypersensitivity, and but this risk is minimized if we are taking the insulin analog, which are more purified forms of. Then lipodystrophy may happen. Like what is lipodystrophy? Because of the basically dystrophy of the adipose tissue. Okay. If the insulin is given repeatedly at the same site, there is risk of dystrophy. So, how can you prevent this? We advise rotating the site of injection. So, injection site should be rotated. Avoid this. Yeah. Myopia may happen because of the fluctuating blood sugar. There may be the power of the lens that can cause contain the vision. That is known as myopia. Then edema may occur because of the retention of the salt and water. Then weight gain may happen because of the edema. Then obesity may happen and insulin resistance may happen. And this is more in traditional insulin. These are important common ADRs of these are the advantages of the insulin we have already discussed. Less chances of early postprandial hyperglycemia, late hypoglycemia, less chances of allergic reaction, less chances of resistance, risk of lipoatrophy. Then coming to the therapeutic indications of the insulin. The important indicators number one is the type 1 diabetes or insulin dependent diabetes mellitus. There is absolute deficiency have to replace the insulin hormone. Second is type 2 diabetes mellitus not controlled by the diet and oral hypoglycemia. Type 2 diabetes advise the patient about the lifestyle changes, like will advise the patient to control the body weight, proper exercise, take your meals at regular interval, take less carbohydrate diets, but and oral hypoglycemia. But after some time, after 5 years, 10 years, oral hypoglycemic drugs stop working. Then you will have to replace with insulin. In type 2 diabetes, it is complicated by any surgery, infection, trauma, or stress. In condition of these conditions, you will require insulin oral for these conditions. And post-pancreatectomy because of any surgery of the pancreas. Then gestational diabetes mellitus. The diabetes happen or detected during the pregnancy. Then it is known as gestational diabetes. So gestational diabetes also we cannot give oral hypoglycemia. Can you explain why we cannot use oral hypoglycemia? Fourth row, third row. Why we can't use metformin in gestational diabetes or any other oral hypoglycemia? Why glycemics are not used for gestation? Why injections are required? Oral hypoglycemic drugs like metformin, they can cross the placenta. They can affect the baby, but the insulin is a natural hormone and it has a large molecular weight. So it cannot cross the placenta. So it cannot affect the baby. And there is also risk of congenital anomalies with that is known as teratogenicity. Yeah, because of teratogenicity, what also gives and these drugs may cross the placenta. But insulin is a natural hormone, it is a safe hormone. So you can give the insulin during the insulin is the gold standard for the treatment of the gestational diabetes. And then complications that may happen type 1 diabetes, like diabetic ketoacidosis, in which we can give intravenous regular insulin. These are the various indications of the. What are the factors affecting the absorption of the insulin? Subcutaneous usual route of administration. Various factors that can affect the absorption, such as site of injection. Most rapid absorption is from the abdominal wall, then from the arm, buttocks, and thigh. The rotation of injection site rotation is done to avoid the risk of lipodystrophy. Then different types of injection, subcutaneous blood flow. More the blood flow, more will be the absorption. Local muscular activity, more the muscular activity, more rapid will be the absorption. Then volume and concentration of insulin, then depth of injection. There are various factors that can affect the rate of absorption of insulin. So, if the various insulin is given in the abdomen and the side is rotated to avoid the risk of lipodystrophy. While the periumbilical space is left, insulin should not be injected around the umbilicus. Veins होती है the thickness of the skin, there is variable thickness of the skin. So the rate of absorption may differ because of the difference in the thickness of the skin. The rate of absorption may differ. So sometimes it may be absorbed from there, sometimes it may not be absorbed. That is why it will not be given in the periumbilical area. It can be given in the interior abdominal wall, and the side will be rotated. And this is the syringe. Insulin can be given with the help of subcutaneous needle and insulin pen. Like pen is very can be given pre-filled syringe. Pre-filled that is the pen and that is injected. That is very convenient. Keep it like a pen. It is very portable device. This is the glucometer for the monitoring of the blood glucose. And nowadays there is continuous glucose monitors are available. So there are sensor-like device that is designed and it will detect the 24 hour. It will monitor the blood glucose 24 hours. It will monitor 24-hour blood glucose. That is continuous glucose monitor, CGM. And these are the various insulin delivery devices like insulin vial and pump system is available. Then smart insulin pen, then insulin pen, disposable single patient insulin pen, and this is insulin management system of a quad and personal diabetes. Nowadays, uh, some insulin pumps are also available that can deliver the insulin at regular interval. But there is also some risk. For example, if there is any error occurs in the software, what will it can deliver the insulin. So there is risk of insulin overdose and patient may die because of the hypoglycemia. So there is also risk associated with the insulin pump. So nowadays, most commonly insulin is given by insulin vial and syringe and by insulin pens. Now there are three important regimens. One is basal bolus regimen, second is split mix regimen, and third is sliding scale regimen. So these are the three important regimens that are given by we can give the insulin hormone. Basal bolus regimen. What is basal? Basal means that baseline and blood insulin देते हैं that is known as basal regimen. और bolus का मतलब होता है immediate post-prandial hyperglycemia जो होता है खाना खाने के फौरन बाद जो ब्लड ग्लूकोज लेवल पीक करता है को कंट्रोल करने के लिए that is known as bolus. That is why it is basal bolus is why it is called as basal. So it is used to control the blood sugar. The basal dose is given to control the baseline level of the blood sugar. And bolus given to control the postprandial hyperglycemia. So it is the most you can say the best regimen for the control of blood sugar because it mimics the normal blood sugar control. अच्छा अच्छा कहाँ लगा है तो basal bolus regimen is the most you can say physiological method to control the blood sugar because the basal dose of insulin is given to control the baseline blood sugar and bolus dose is given to control the postprandial hyperglycemia. What will happen? Suppose if you are prescribing a basal bolus regimen, you will ask the patient to inject the insulin before each meals, like before breakfast, before lunch, before dinner, and at bedtime. So at bedtime, we will give the basal dose of the insulin. So we will give the long acting insulin, very long acting insulin like insulin glargine we can give to control the basal level of the blood sugar. So the basal dose is given before bedtime or before dinner to control the blood sugar, or you can also give the basal dose of insulin you can give just before the any major meal. You will ask the patient which is your largest meal. Suppose patient will say I have largest meal of dinner, so you will ask the patient to take your basal dose of long acting insulin before the dinner, and you will just and short acting insulin or rapid acting insulin you will give before each meals. So you will ask the patient to keep your injection ready and to keep your breakfast ready, and before taking the breakfast you will inject first. You will monitor the blood sugar prick blood sugar, then you will take very short acting insulin or rapid acting insulin, and after injection of rapid acting insulin you will take the breakfast. Okay, similarly before the lunch, patient will monitor the blood sugar, then he will inject the short acting insulin or rapid acting insulin and he will immediately take the lunch. Similarly before dinner he will first monitor the blood sugar, then he will inject the rapid acting insulin and then he will immediately take the dinner. So this will control the blood sugar 24/7. So that is known as, it is known as basal bolus regimen. So we will give the long acting insulin before the major meal and short, rapid acting insulin before each meals. But what is the risk? What is the problem in this regimen? Can anyone tell? What may be the drawback of this regimen? Ah, yes, very good. So patient have to multiple times prick his body. Okay, so multiple injections are required over a day. So this is one major problem. Second major problem is there slightly more risk of hypoglycemia because the patient is taken insulin multiple times in a day. So the risk of hypoglycemia will be more. So these are the two major important limitations of this regimen. So although it is a very good regimen, intensive, you can also say it is an intensive regimen, but there is risk of hypoglycemia and patient have to multiple times inject the body. Okay, so this is about the basal bolus regimen. Second is regimen is known as the split mix regimen. In the split mix regimen, we will ask the patient to first calculate the total dose of the insulin. What is the how the insulin dose is calculated? Suppose if a patient has a body weight of 60 kg, so how will you calculate the total dose of insulin? So the normal insulin requirement is 0.3 to 0.5 unit per kg. Suppose the patient has a body weight of 60 kg, so patient will require roughly 30 units of insulin per day. So he will divide the whole full dose into two groups, two parts. Okay, split mix regimen. So 15 unit he will take before the breakfast and 15 unit he will take before the dinner. So in the split mix regimen, two injections are required, one before breakfast and one before the meals, one before the dinner. So it is known as a split mix regimen. So it, although it strictly not control the spikes of blood glucose, because you can say there is some overlapping hyperglycemia. But the advantage of this regimen is that multiple daily injections are required less. Only two injections are required per day, and also there is less risk of hypoglycemia. So these are the advantages of this regimen. Okay. And he will use the combination of insulin. He will use the combination of short acting and intermediate or long acting insulin. So he will use combination of insulin, means he will use the rapid acting insulin plus intermediate like NPH mixture. Pre-filled insulin syringe are available. Pre-filled mixture are available. So he can take the mixture of short acting. Short acting will control the postprandial hyperglycemia and the long acting will control the basal level of the blood sugar. So he will take the mixture of these two types of insulin. The short acting will control the immediate postprandial hyperglycemia and the intermediate acting will control the baseline level of the blood glucose. And one more scale is available, that is known as sliding scale. It is primarily used for those patients who are hospitalized in the patients. So in this regimen, the nursing staff will check the blood sugar of the patient and according to the level of the blood glucose, he will inject the insulin. For example, if the level of blood glucose is 61 to 150 milligram percent, so it is a random blood sugar monitoring. So if the blood sugar is up to 150, there is no need of any insulin. If the level is, for example, 200, so the nursing staff will inject 3 unit of insulin. If the level is 250, then he will inject 5 units of insulin. So according to the level of the blood sugar, insulin is injected at regular interval. So this is known as a sliding scale of insulin, but this scale is used primarily those patients who are hospitalized in the patient hospital. Okay. And if the blood sugar becomes very high, for example, more than 400, then physician should be contacted because it can cause various complications, very high blood sugar. So what is dawn phenomena? The requirement of insulin increase in the early morning since there is a rise in the blood sugar with sunrise, probably due to greater clearance of insulin in the morning. In the morning, there is more clearance of insulin, so there may be rise in the blood sugar in the early morning. That is known as the dawn phenomena. And what is Somogy phenomena? Nocturnal hypoglycemia has been considered as a cause of hyperglycemia in type 1 diabetes due to involvement of the counter regulatory hormones. So this is known as the Somogy phenomena. So in patient of type 1 diabetes, suppose he injected insulin before the dinner, but there may be, suppose due to mistake, he is taken more dose of insulin. So nocturnal hypoglycemia may happen. Okay, and this can cause to compensatory increase of counter regulatory hormones that can cause hyperglycemia in the morning. So that phenomena is known as the Somogy phenomena. Okay. Okay, now we will cover the remaining part in the next lecture. Akansha, attendance.